Have you ever wondered what a chiropractic adjustment actually does? Is it just cracking, or is there something therapeutic about the adjustment? Well, in today's video, I'm going to show you exactly what is going on. A chiropractic adjustment, or spinal manipulative therapy, SMT, is a targeted, high velocity, low amplitude thrust towards a segment in the spine. So when joints are stuck, even if they're in a completely neutral position, the body kind of responds with muscle spasming and stiffness and soreness. What we're doing as chiropractors is finding those joints that are stuck and simply making them unstuck. Use the term misalignment or alignment issues. It has nothing to do with alignment and more to do with mobility. The body or the spine isn't supposed to be a fixed object. We're dynamic. Motion is life. That popping sound you hear, that cracking sound, is just gas going off in between the joints. It's literally a liquid between the joints going from a liquid state to a gas state, creating that popping sound. It's sort of like when you crack your knuckles. So it's not a bone on a bone, it's just gas being released between the joints. And I'm, in a way, kind of looking for that because it tells me, again, the joints moved, and that's what we're trying to do, is restore that joint movement. So why do people get adjusted? Well, it's pretty obvious. People have neck pain, headaches, lower back pain. There is a ton of research that suggests, and there's a lot of evidence, that chiropractic care for musculoskeletal issues, specifically neck pain and back pain, are more effective than over-the-counter medications, prescription medications, and of course surgeries. For most people, chiropractic is completely safe. Some people might experience a bit of soreness after an adjustment. That's completely normal. If you worked out, or if you haven't worked, I should say, and it's been a while, you might be a bit sore after an adjustment. But even those people are rare, in my opinion. Most people feel almost instantly better, or even they feel slightly better. The care plans with chiropractic range quite a bit, but the evidence suggests 2 to 3 times a week for 2 weeks. You do a reevaluation on visit 6 or at 2 weeks, whichever comes first. And at that point, you make a decision with your patient or with your chiropractor to continue with care, or if we need to do something else, or maybe refer out. Finally, if you've made it this far, hit the like button, subscribe for more chiro tips, and book a consultation in the description with me, and I'll see you on the next video. Have a great day. Bye.